Well, I've got 7 o'clock, so if there are no other candidates, we will begin. Good evening, everyone. Thank you for coming to be part of the public forum that freedom in our country provides us as we elect our government officials. I'm Dwayne Knott, and I've worked at the EPA as a field biologist, and I'm a retired Air Force veteran. I served as Chief Public Health Officer and Vice Commander of the 139th Medical Squadron, and I'm a veteran of the first Gulf War in Kuwait in 1991, and served as a U.S. Environmental Liaison to Kuwait with the State Department in 1992. I was deployed to Iraq in 2003 and 2004, and I served with a forward-based combat zone medical facility. I also served in Afghanistan in 2006 with the State Department, assisting with the setup of the first dairy pasteurization plant ever in the country, which was subsequently destroyed by the Taliban. I'm currently a board member of the Smithville Chamber of Commerce, the Smithville American Legion, the Smithville Historical Society, and Valor Ranch. I'd like each of the candidates to take 3 minutes to introduce themselves to the audience, and after introductions, each candidate will have 3 minutes to answer the questions put to you. We will start each question answering session by advancing to the next person down the line to be the first to answer. Do you have any questions? I do. Lucky you. Okay. Thank you so much. My pleasure. Candidate number 1, 3 minutes to introduce yourself, ma'am.
Hello, my name is Kim Swaney. I'm a registered nurse, and I have been a registered nurse for 23 years. I have lived in Platte County my entire life. I actually grew up in Camden Point and graduated from North Platte High School. So this is my old stomping grounds. I currently live in Kansas City. I have worked in multiple areas of nursing. I've worked in public health. I worked for the Platte County Health Department in the early 2000s. I worked home health hospice. I have worked as a clinic manager for St. Luke's, and I'm currently PAVE coordinator and a care coordinator for the Kansas City VA. And I have been there for 3 years. The reason I'm running for the health department is I want decisions made based on data-driven, evidence-based information and practice. I want to make sure we're being fiscally and financially responsible to our taxpayers on policies and decision making. I want to make sure that those decisions are based on the population of Platte County and what their needs are. I want to make sure that this is not something we're not making decisions based on other municipalities around us. It's based on our Platte County residents. I also want to ensure that we have adequate, that the citizens of Platte County adequately informed of what services are provided by the health department. What can we meet their needs? We need to look at that. We want to make sure that we are judging our activities and our performance to meet those needs of the citizens of Platte County.
Hello, my name is Susan Cole, and I'm running for the Platte County Health Board. I was very excited when I heard that there may be some positions opening on the Health Board, because I thought with my nursing background, I could contribute to the board and as well as continue to serve the citizens of Platte County. A little bit about myself. I grew up in a small farming community in western Kansas and went to the University of Kansas. I received my Bachelor's of Science in Nursing at that point. I'm married. My husband Clint's in the crowd. We have 2 grown sons. Our older son just became a doctor and is doing his residency at the University of Missouri in Columbia. And our younger son is a financial person, a commercial financial analyst with a financial institution in Kansas City. My experience with nursing has been pretty much cardiac nursing. When I was in the hospital, I worked telemetry units and the cardiothoracic surgery ICU. I had the opportunity to take care of the first heart transplants, an adult and a child as well. And then I also have done nursing management in the telemetry area for 10 years. I worked also as an infection control employee health nurse for about 3 years in a community hospital. And the last stint in my career has been school nursing. I was the school nurse at Park Hill High School in the Park Hill School District for 14 years. And it provided, trust me, school nursing is not just Band-Aids. We always thought it was, but I did a whole lot more. In the last 2 years, I have worked at probably every school in the Park Hill School District, in the grade schools and middle schools, because I retired officially 2 years ago, but I stayed on as a substitute. When someone asks me, why did you want to be on the health board? And I know it may sound corny, but I really want to continue to use my nursing skills and contribute to the citizens of Platte County. I believe it's very important to make evidence-based decision-making, be fiscally responsible, be accountable, and available to the citizens of Platte County. You are paying taxes in this community, and it is my responsibility to listen to you and to be transparent to you and be available to you. And I think that's very important. I would be honored to work for the citizens of Platte County, and I would appreciate your vote on April 4th. Thank you.
Hi, my name is Mary Gold Fry, and I am running because a friend of mine said a position's open up, and it's a friend who I used to work with at the Kansas City, Missouri Health Department back in the early 90s. I arrived in, I came to Kansas City after graduating in 1992. I lived in the Northland ever since then. Like I said, I used to work for the Kansas City, Missouri Health Department. I am currently, and after being a stay-at-home mom, I decided to work with a family business. I am the corporate treasurer of a small family business. I've been doing that for the past 20 years. We live in Smithville area, but we live in unincorporated Platte County. We raised 2 children. My husband Jack is here with me right now. I'm pretty excited to be here. I have to admit, I am nervous. This is like I've never ran for a position, so everything will be a bit spotty. But when the opening came up, I just thought this would be a great opportunity for me to serve this community. I'm hoping that you would give me that chance. I am familiar, I've served on boards in the past of other organizations. I know how to read financial records. I keep track of finances. I felt the pinch of the past few years. And it's frustrating, but to make this full circle, to go back into public health, where I first started when I moved out here, I think would be great. So I hope you consider me. I do have a website that's going to be coming up, marygoldfry.com. And it's right here, you can know more about me since I'm a bit spotty. So, but thank you for inviting me. I appreciate it.
Good evening. My name is Steve Hager. I live in Platte City, where we've been for the last 20 years. My wife and I have raised our 2 daughters there, and we're now helping raise a 5-year-old grandson. Proud to have him be a pirate as well. I've been a licensed paramedic since 1990, and that's where my career started in healthcare, was in pre-hospital care. Currently, I work for a large hospital in Kansas City. I'm the emergency manager. And so through my career, a lot of what I do every day is working with hospitals, public health, emergency management, EMS, and other parties that touch healthcare in a disaster, and make sure that we're planning for continuity of care and being able to provide that care in difficult times. I think healthcare right now, we're facing a crisis like we've probably never seen before. Healthcare is really teetering, and it won't take much to push us over the edge. So public health, it is essential in making sure that we can continue providing resources to our communities and reaching out to folks who are likely underserved. And while in Platte County, we're fortunate that for the most part we have a lot of resources here, but public health, I think, will have a role that's more important than it's ever been. And a lot of what public health is tasked with is preparing for disasters. I'm currently the chair of the Mid-America Regional Council Healthcare Coalition, and have done that for the last 3 years. I took that position over just prior to COVID starting, and was asked to do a lot of the public information officer. So I did a lot of TV interviews, radio interviews, talking about the impact of COVID and other situations that were impacting hospitals and the overall health care in the community. So with my experience, I tend to only try and get involved in things where I think I have some expertise and something that I can contribute. When I moved to Platte City in 2002, I was elected to the ambulance district board, where I served for 6 years before stepping off to pursue some other interests. And then in 2017, I was asked to be a city alderman in Platte City, where I've served for the last 5 years as a city alderman. And so I'm engaged in the community. I'm proud to say that the city of Platte City, all of the elected officials there know how to listen to the public. And when we put things on the ballot, we're typically able to get those approved, because people have confidence in us. Thank you.
Hope you don't mind if I stand. I speak better when I stand. I'm more comfortable. My name's Dr. Michael Chaffee, and I'll tell you a little bit about me first. I am a husband of 25 years. My wife, Dr. Heather Eisen, is here. She works at a major hospital in the emergency department downtown. It's an academic center. I grew up in Lee Summit, and in 1984, when I was in college, my parents moved to Weatherby Lake, and I used to joke about that I was still able to find them. After I graduated, I took my first position after becoming a resident, I was chief resident, and I finished my residency, and I actually took my first job at the hospital I was born in, St. Luke's on the Plaza. Bought a house next door to my mom and dad at Weatherby Lake. A year later, got married. We have 4 beautiful boys, 18 to 24. Subsequently, about 2000, we moved to Augusta, Georgia, where I took on a position as medical director of the emergency department at a level 1 trauma center. During my time there, I got to become very efficient in ED operational efficiency. I've lectured nationally on that. During our time there as well, I served a role in Quantico, Virginia, as a medical support person to the FBI. Subsequently, I published papers on ED operational efficiency and the such. When we moved back to Kansas City, I took a 1-year sabbatical, and my father said, you need to open urgent care centers like you had planned to before you left. And so I have now operated 4 urgent care centers over the last 16 years. 3 of them we sold in 2015. Kind of ran out of things to do, and since then I was asked to serve on the Platte County Board for the Development of the Disabled, which I've done for the last 6 years. While on that board, I was informed there was an opening, and Currently, I run several businesses. I have an urgent care in St. Joe. And I looked at it, I said, I got a lot of business experience. I've built clinics, I've operated clinics, I understand it. And the things that make me passionate about this is that I think our community needs policies that are data-driven. We need to limit government overreach. We need to increase preparedness and efficiency. I'm good at efficiency. And finally, we need policies that will protect the safety and health of our community without neglecting the needs of our students and businesses. Hi. Almost like it was reversed.
Okay, First question to you, and thank you for each introducing yourself. What is your view on supporting a second health department clinic or relocating the current clinic in a more central location to the population in general, and more specifically, the population that would be most likely in need of an additional or relocated facility?
I'm the lucky one that gets to be number one in this question. So, my opinion on that is, I don't, at this point, I think that has already taken
Now, you can hear me now. So my opinion on that, I'm not sure at this point that has already taken place. So I believe that is in the process of occurring. The issue at this point is the county is very, the northern end is very rural, southern end more city, so people are used to having those two locations and have liked the access to those two locations. The issue at this point, I think, is to determine how we're going to proceed from here. We have a situation where there is issue with who owns the building in Platte City. I don't know that that's been resolved. And then we have issue with how the building, once this situation is where the building is completed at the airport, how it's going to be paid for. At this point, we are looking at what looks to be about a $7 million bill for this building. And I don't think the budget-wise, this is completely over what was expected. So the question is, for me, going forward, how is this going to be paid for? How are we going to do this? And we've looked at the cash. Now the cash reserves for the health department have been used to pay for this building. What down the road, if there's an issue such as another pandemic or something that's going to need, where we're going to need funding for emergency issue, how are we going to support that? Or do we have the budget to support it? And I don't want to be the person to go back to the taxpayers and ask them to raise a tax levy because we don't have that money. So in a roundabout way, that I think is the issue at this point with the move. And this decision was made in a time where we are entering into a pandemic, and maybe that could have been tabled and taken to a vote by the public.
When I was the full-time nurse at Park Hill High School, I utilized the health departments a lot, the Kansas City, Missouri Health Department, and I utilized Parkville Health Department. They were extremely helpful with a lot of issues I had, whether it was vaccinations, We had a foreign exchange student, that type of thing. When I first heard, oh, we're going to sell the Parkville office and the Platte City, I was a little overwhelmed because I thought, and just one facility and et cetera. I was like, oh my gosh, because I had so many students, and sometimes I'd have to get cabs to get them to the Parkville building. But as I kind of learned, I guess it's going to be on the bus route. And so having one and maybe being closer to some of the rural areas, maybe I needed to maybe learn a little bit more why that decision was made. My concern, that to me was a pretty big decision. To go ahead and we're going to close this one, and we're going to the south side, and we're going to close the north side. And granted, I sit here, I was not at the meetings, and I can sound really smart maybe now versus not being there and the decisions that the board had to make. But to me, the taxpayer, it's just so important that maybe they had some input on moving that and having some decision on having just the one health department. It also is kind of an issue that just from reading the papers and that maybe there's the finances that it's taken to get to this health department. And I think, and I was at the meeting on Tuesday night at the health department, that $3.5 million was maybe the projected, and if they had sold the Platte City building and the Parkville building, there would have been enough funds and maybe some left over. But now we got into the pandemic. Trying to get supplies has taken longer. I mean, houses that are being built around me took a lot longer in the pandemic. And now it has increased, and we're looking at $7 million. And that's the taxpayer money. And it's whoever gets on the board is going to have that decision. We're going to have to work with that and figure out how we're going to get that paid. And so that's a concern. But maybe there was a lot of good decisions in terms of having the one building.
Yes, that is a very intense question because it's definitely a concern in regards to this new building. The centralized, I know when I was at the Kansas City, Missouri Health Department, I was during that. I was in that transition where they would move the three or four locations into one building. And I thought that was a very good move because a lot of things can be done in one spot as opposed to transferring back and forth. The location of the building is central. I think maybe one of the issues that we would see is like maybe transportation. Those who are in Parkville would have to go, I would feel, a little bit further out, if I'm thinking correctly. I think if so many, it's just so, I think it's a good move, but the timing was just awful. Hopefully, things can be resolved as we move forward, because what's done is done. Unfortunately, we're encountering rising costs in the building a new building, but I think in the long run, it will be beneficial. I know with collaboration with the Northland Health Alliance, they're also trying to incorporate transportation for those people who are in need for, services with the health department.
Yes, as has been pointed out, the building is already in progress. They're likely going to move in this spring, so nothing can be done to change that. Decisions on why it was done, we're all speculating. Again, we weren't sitting in those meetings, but I know being able to provide resources when you're splitting that between two locations and being able to consolidate that into one location where they can try and provide the best resources to the entire community. And, splitting it out between two different locations, you're better for those two communities, but you're probably not offering the full scope of service, so you may have to still go to the other location, and reducing it down to one is where we're at. Again, the timing, I think all of this was started well before COVID happened. and the ball was already rolling, and they opted to continue and go with it. And I think part of that was knowing that they needed the additional space and resources to provide the care and requirements that were being faced with COVID, and knowing that they were going to have to expand services and do other things. And I think probably the plan would have been to be in the building already. However, with delays, and we're experiencing the same thing building a new city hall, it's more expensive than what we had originally budgeted in Platte City. It's taking longer, but at the end of the day, we hope to have the best resources for our community. And as a board, we're inheriting those issues, and we're just going to have to figure out how to make the best of it and make it fit within budgets for the next number of years to pay for it.
Would it be okay for me to ask you to say the question one more time? Of course. I want to make sure I address it.
Of course. What is your view on supporting a second health department clinic or relocating the current clinic in a more central location for the population in general, and more specifically, the population that would be most likely in need of an additional or relocated facility?
One of the things I learned in running an emergency department and business is if you can't measure information, you can't manage it. So I think a needs assessment needs to be done looking at the location of the clients, the transportation abilities, and if we can't make accommodations, then we make accommodations. We have to figure out what we need to do. So a second location could be done. You can get a second satellite location. Probably some city towns can donate those. You could set up temporary facilities for very little money, and a lot of doctors were doing Zoom calls. I think a lot of services can be done, especially with the new software that they just agreed on Tuesday to purchase, that you can do some virtual visits to assess the needs, assess how we can do that. So location-wise, mostly, we got to make sure that people can get there. So yes, I think we do need to do a needs assessment, find out the data. Once we have the data, then we make the most efficient move to address the needs. I could talk about what has happened so far, but we've got a 24,000 square foot building. It costs $275 per square foot after the purchase price of the building and the renovations, which were scheduled at $384,000. I mean, $3,800,000. The winning bid started at $3.8 million. We're going to be $6 million. A lot of money. But we need to go ahead and do the best we can to capitalize on where we're at, figure out what the needs of the public are based on measuring metrics, measuring locations, measuring the folks who have access, who don't. And then we can say, how can we best address their needs? Maybe a second location isn't going to be the most efficient way, but if it is, I would support it. I think we need better transparency with some of these decisions that go on. These are conversations that need to be held in executive session. It's come to my attention that a lot of these things were held in executive session. I think executive session should never have discussions whatsoever that don't have to do directly with the reason to be in executive session. I think our meetings should continue to be public on Zoom. And one of the things I plan to do is I'm going to start a YouTube channel, should I be elected, or maybe not. But I think the neat thing about the YouTube channel is you can have a board member give a weekly update of what's going on, what we're thinking about, and people can put their comments in. I think we need to get surveys out. And maybe we can do the analysis ourselves. But that's how I would address the question there. And yes, it has been a challenging time with this transition. And could things have been done better? Sure. I agree with the rest of the candidates. Let's see where we are, assess the needs, and figure the most efficient way to address it.
Thank you. You can get this signed.
I begin this, okay.
Yeah.
Okay.
It's fair. You shouldn't have to do it.
Thank you. I like that.
That's good.
Thank you, candidates. Question 2.
Question number 2. In the event of another health crisis similar to the recent COVID-19 event, What changes, if any, would you propose in the advanced planning for the Platte County Public Health response to such a crisis?
Well, inevitably, there probably will be something that we'll have to deal with. When I was, in 2009, it was H1N, well, let me go back even further. When I was working in the hospitals in the 1980s and 90s, it was the AIDS crisis. Then it was, when I was in the school district, it was H1N1, and then COVID happened. And we were able to take care of patients, take care of students, and we didn't have to close anything. COVID came around, and it seemed kind of different, and we were somewhat frightened. The public was frightened, and what would we do? And I think I don't know all the answers, but to me, I had teachers coming up to me in Park Hill and saying, "Sue, we're not going to close school." And I said, "Well, surely not. I mean, the students need to stay in school. We need to get herd immunity." We had H1N1. I had students coming in with 105 fevers in August. I had mothers calling me, "Well, Susie's a locker mate with Sally, and what's going to happen to her stuff?" And I said, "Well, nothing's going to happen to her stuff." I said, just use common sense and don't send your kid to school if they have a fever. Well, COVID happened, and anything I would say to the teachers based on my previous experience with infection control, employee health, just kind of went out the window. Everything was new. And I would say, if we have the chance, we are Platte County. We're not Clay County. We're not Jackson County. We're not St. Louis. We are Platte County, and we need to look at the data that we get from this county. We need to investigate, look at research based on maybe previous pandemics, and make evidence-based decisions. And not, before we close a business, okay, we're going to close a church, but the liquor store can stay open. Makes no sense. Or the curfew. Oh, we got to change the curfew to 10 o'clock, not 12 o'clock, because I guess more people are going to get COVID in those 2 hours or get part of that. Some of the decisions made were just crazy. Let's use our common sense. Let's use knowledge-based data that's there and make some good decisions and good healthcare decisions for our Platte County people.
Thank you.
That is a really good question. I think, in my opinion, we should have been paying attention instead of getting distracted by what's going on in other worlds. I mean, if you see a storm, dark cloud coming, you don't just stay out there to keep playing until you win. You just see the dark cloud, go home. In this case, though, if something were like this to be happening, I am hopeful that maybe the health department or the hospital, anyone, just keep an eye out. What's going on? Is it going to be coming here? It's not. And as for any changes, that would depend. I think when this pandemic happened, it was a very reactive type of how we took care of it. Just lockdown. I don't entirely agree with that. I think we should have paid attention to what was going on in other countries and then make adjustments, tweak it, and go forward. I don't think we really had to shut down like that. I think we could have taken precautions to limit the spread. Exactly what that entails and the specifics will depend on the pandemic, but we just need to keep an eye out on what's going on in other places. If it's coming, you got to be prepared.
Thank you.
Number one, follow the science, understand the progression of the disease, what it means, and at the beginning that's not always easy. The information we had was what we're seeing from overseas, and we were reacting to how it was behaving in those communities, in those countries, and we were trying to make the best guess on how it would spread here and what the impact would be. Number two, take the politics out of it. A lot of things were politicized, and decisions were being based off of that. Politics don't belong in healthcare. We need to follow the science, we need to follow the data, and leave politics out of it. Number 3, make sure that the communities are prepared and have business continuity